You think your mattress is too hard, but the reality is you are mechanically crushing your own tendons every single night. In this video, we are going to fix your sleeping geometry so you can sleep on your side without waking up in agony. We aren't buying a new bed. We are going to use the glute stack method and two other adjustments to delete the pressure instantly. If you want to walk pain-free tomorrow morning, you need to change how you lay down tonight. Let's fix it. Welcome to Gentleman's Vitality, where we cut through the noise to help men over 60 take control of their health. If you are struggling with hip pain at night, you understand how it sabotages everything. Pain wakes you up. Fragmented sleep lowers your testosterone. And low testosterone destroys your energy and motivation. It's a vicious cycle we need to break tonight. The common thinking is that pain means arthritis or a bad mattress. For the specific pain we are talking about, that sharp, aching discomfort on the outside of your hip, right where the bone sticks out, the true culprit is usually something called greater trochanteric pain syndrome. Simply put, it's tendon compression. When you lie on your side, especially if you're a heavier man or you sleep on a firm surface, your body weight presses the tendons and the bursa sac directly against the bone. If you're over 60, these tendons lose elasticity and become less forgiving. They don't stretch, they complain. Now, before we get to the fixes, let's clear up the biggest mistake nearly every side sleeper makes: the fetal position. It feels cozy, but it's a killer for your hips. When you curl up tight, pulling your knees way up toward your chest, you drastically increase the tension on your iliotibial band or IT band and the gluteal tendons. Think of your thigh bone like a lever. The tighter you curl, the harder those muscles pull across your hip bone. You are literally setting yourself up for compression and pain before you even fall asleep. So how do we reverse this compression without completely retraining how you sleep? The solution isn't about avoiding side sleeping. It's about mastering your alignment. Let's start with the immediate, crucial adjustment that solves 80% of night pain. This is Adjustment 1, the parallel spacer. Most men use a thin, wimpy pillow between their knees, or maybe no pillow at all. When you do that, your top leg falls across your body. That top knee and thigh acts like a dead weight, dragging your entire leg's momentum down. This internal rotation is what creates the severe crushing force on your bottom hip's tendons. You need a spacer that is firm enough and thick enough to keep your top thigh bone perfectly parallel with the bottom thigh bone. The goal is geometric. Your ankle, your knee, and your hip bone must stack directly on top of each other in a clean, vertical line. You might need 2 standard pillows or a specific body pillow for this. Test it now. When you lie on your side, if your top knee is sagging down to meet the mattress, your spacer is too thin. Find a spacer thick enough that the space between your knees, when lying down, is nearly identical to the width of your thigh. This spacer prevents the top hip from internally rotating and pulling on the inflamed tissues. It restores balance to your pelvic girdle, immediately relieving the primary source of the friction. If you get this one step right, you will notice a difference tonight. If you find this practical approach helpful for managing aging and vitality, please take a second and hit the like button. It tells us we should keep making these evidence-backed guides for men over 60. Now that we've solved the internal rotation problem with the spacer, we move to the second critical mistake: direct, sustained pressure. This leads us to adjustment 2, the 30-degree tilt, or the glute stack. Even with a perfect spacer, if you are lying exactly perpendicular to the mattress, 100% of your body weight is still bearing down on the small area of your greater trochanter. This is where the bursa lives, and it doesn't like being squashed for 8 hours. The fix is deceptively simple. You need to offload the pressure by shifting your weight slightly backward. Instead of lying flat on your side, you want to be tilted back about 30 degrees, resting slightly on your glutes and the thick musculature of your buttocks, rather than the bony prominence of your hip. How do you achieve this? Use a long body pillow or even a simple rolled-up towel tucked firmly behind your back, from your shoulders down to your lower back. This acts as a wedge or a ramp. It forces your torso to lean back just enough that your primary weight-bearing contact shifts from the side of your hip bone to the resilient, muscular padding of your rear glutes. You are using muscle mass to cushion the impact, not bone and inflamed tissue. When implementing the glute stack, make sure the support behind you is firm enough that you can't easily roll flat onto your side. The goal is semi-side sleeping, not true side sleeping. This dramatically reduces the compression force on the sensitive bursa sac. This small tilt is often the difference between a throbbing hip and a completely silent night. This brings us to the most common objection. I can't stay in one place. I toss and turn. That is a valid point, especially as we age. We naturally shift positions to relieve pressure. If your pain is severe, you must accept that you may not be able to comfortably sleep on the painful side at all for a period of healing. If your left hip hurts, you must sleep on your right side. But here's the catch. When you sleep on your good must 9-5, you still need to protect the bad 9-5 side from pulling. If you sleep on the right side without that thick spacer between your legs, the painful left hip will still internally rotate, stretching the inflamed tendons. Stretching an inflamed tendon is just as painful as compressing it. Remember, the parallel spacer, adjustment 1, is non-negotiable regardless of which side you are sleeping on. It's always there to maintain neutral alignment. We've fixed the alignment and reduced the pressure. But what about the deep-seated muscle tension that builds up during the day? For many men over 60, hip pain isn't just a compression issue. It's a tightness issue caused by hours of sitting. This leads us to adjustment 3, the 3-minute pre-sleep release routine. If your hip flexors and surrounding gluteal muscles are tight when you go to bed, they will pull and tug on your hip capsule and tendons all night long. A quick, safe routine before bed can dramatically relax these tension points. This is not a workout. It's a gentle decompression protocol. The first step is the asterisk standing glute cross. Asterisk, stand next to a sturdy chair or counter for balance. Cross your painful leg over your good leg at the ankle. Gently push your painful hip out to the side, away from the center of your body, until you feel a gentle stretch along the outer hip. Hold this for 30 seconds. Do not bounce. You are aiming for a release, not a massive stretch. This addresses the tightness in the tensor fascia latae, or TFL, a small muscle that attaches to the IT band and is a major contributor to nighttime tension. The second step is the *gall lying windshield wiper. *gall lie flat on your back in bed with your knees bent and feet flat. Keeping your feet planted, slowly let your knees drop together gently to one side, hold for 5 seconds, and then drop them to the opposite side. This is a very mild, non-weight-bearing spinal and hip rotation. This movement gently hydrates the hip capsule and encourages the deep rotator muscles to relax. Do this slowly for 60 seconds. The third step is the *seated figure 4 gentle release. Sit on the edge of your bed or a sturdy chair. Cross the ankle of your painful leg over the opposite knee, like making a 4. Instead of leaning forward, simply place your hand on your crossed knee and gently push down very lightly for 10 seconds. You should feel a stretch deep in your glute, but crucially, no pain in your hip joint. This move targets the piriformis, another muscle known for creating referred pain that feels identical to bursitis. This 3-minute sequence, the glute cross, the windshield wiper, and the figure 4, primes your muscles for sleep. You are actively reducing the baseline tension before you even commit your body to the position for the night. This is key to preventing the throbbing pain that often starts an hour or two after you fall asleep. Let's quickly address 2 common scenarios we encounter with gentlemen over 60. First, what if the pain is radiating down your leg or feels more like numbness? If you have tingling or pain traveling past the knee, you may be dealing with referred nerve pain from your lower back, specifically sciatica. While the side sleeping adjustments we discussed are still highly beneficial for general alignment, true nerve pain requires addressing spinal health. This channel covers mobility and core strength in other videos to help with that. If the pain is sharp and radiating, talk to your primary care physician about a physical therapy referral. We stick to biomechanics and alignment here. Second, the myth of the soft mattress. Many men believe they need a super plush mattress to cure hip pain. In reality, a mattress that is too soft can be just as bad, if not worse, because it allows your heaviest points, your hips, to sink too far. This collapses your spine and throws your entire alignment out of neutral. The ideal mattress for men over 60 whose side sleep is medium firm with a soft surface layer. It needs enough support to keep your spine straight, but enough give to minimize pressure points. If you are sleeping on a mattress that is over 10 years old, the springs or foam have likely collapsed in the center, creating a permanent sag that guarantees misalignment. So let's recap the master strategy to eliminate night hip pain. First, discard the fetal position and adopt the open-angle sleeping posture. Second, commit to the parallel spacer between your knees to maintain neutral hip alignment. Third, implement the 30-degree glute stack tilt to offload pressure from the hip bone onto the muscle. And finally, use the 3-minute pre-sleep release routine to eliminate baseline tension before you even lie down. These 3 structural adjustments and the mobility prep are powerful, evidence-based tools. They require consistency, but the payoff is monumental, restoring deep, restorative sleep. Remember, vitality in your 60s and beyond is built on quality rest. If you are sleeping better, your body is producing more growth hormone and testosterone, you recover faster, and you feel stronger. These adjustments are not just about pain management, they are about vitality management. Don't let hip pain steal your energy and mobility. If you are serious about mastering your health, subscribe to Gentleman's Vitality now. We deliver actionable, science-backed strategies every week to help you live a stronger, healthier, and more vibrant life. Try these 3 adjustments tonight. You deserve a pain-free night's sleep.